Hello, dear students. I am Professor Ghada Anwar, Professor of Pediatrics, Cairo University. In this lecture, we will learn together how to search the midline. The objectives of this lecture are how to formulate your search key concept, start your search in the PubMed, do search by keywords technique, use Boolean operator, use PubMed filter, use PubMed search builder, and use the clinical. Let's revise together the basics of electronic search. Whatever your selected database, all searches require the same basic procedure. First, you have to define your question, the PICO question. Then, you choose your key search words from this question. And then you will work into a logical strategy using the available tools and run your search and view the results. And finally, you will refine or expand your search according to the results until you are satisfied. Let's start our search by using this clinical scenario. You have a patient who is a 3-year-old male presented to the ER with purpura, mild gum bleeding. The patient is clinically stable and his physical examination is otherwise normal. Complete blood count is totally normal apart from severe thrombocytopenia. You diagnose this patient as having idiopathic thrombocytopenic purpura and you decided to admit the child and start treatment with intravenous immunoglobulin. However, one of the residents asked you if treatment with pulsed high-dose methylprednisolone would result in similar improvement at a lower cost. So, what is your clinical question here in this scenario? Your PICO question. The question is, in a child with acute ITB, is high-dose steroids as effective as intravenous immunoglobulin in improving the platelet count? Let's break the clinical question into important elements. P stands for the patient or population or a problem, which is in our scenario the child with ITB. I stands for the intervention, which is steroids. C stands for the comparison, which is intravenous immunoglobulin. O stands for the outcome, which is the cure. So that the domain of our PICO question here is therapy domain. From our PICO question, we can pick up our basic search term, which are in our scenario ITB, IVIG, steroids, or methylprednisolone, child. Usually, we don't need the word child on the PubMed search because there are different age groups we can select from them according to our scenario. You have to notice that your search terms may have alternative search words which are called synonyms. For example, ITB may be called immune thrombocytopenic purpura, or idiopathic thrombocytopenic purpura, or acute thrombocytopenic purpura. The same for steroids, may be called glucocorticoids or corticosteroids, and also for the IVIG can be called immunoglobulins or intravenous immunoglobulins. This can be solved while we are doing the search on the PubMed. Let's start our search and see how it goes. Start your search. In your web browser, type in www.pubmed.com or .gov. It will direct you to the homepage of the PubMed. This is the homepage of the PubMed. You can create your account by registration, which is free, into the NCBI, which stands for National Center for Biotechnology Information, and you can type in the search term in the search box. This is the main search box, and do your search. Let's review together the basic search techniques on the PubMed. The first technique is called the keyword technique. A keyword is simply any word in the bibliographic record in any field. A keyword search will retrieve records where word occurs in any field in any record, whether in the author, title, subject heading, and publisher notes. You will realize that the data will be huge and maybe not pertinent to the subject you need. However, a keyword search is useful at the beginning of the search and can help you to find a good subject heading to use. Let's start. Remember, you have three search terms, which are idiopathic thrombocytopenic purpura, steroids or methylprednisolone, and intravenous immunoglobulin. Start by using one search term and see the results and manipulating your search results according to the results. I will choose the word idiopathic thrombocytopenic purpura to search for on the PubMed. Once you start typing the word idiopathic thrombocytopenic purpura, the auto-complete phenomena of the website will complete the word. You have just to click on the word and then click search. Now you got your search results. 5,857 articles about the idiopathic thrombocytopenic purpura, which of course a huge number. You cannot revise them all, and you have to manipulate your results so that you reach an optimum number that is pertinent to your subject. One of the search techniques that can be used to minimize the search results is searching by phrase. And this technique can be applied when one of the search terms is composed of many words. For example, in our scenario, one of the search terms is idiopathic thrombocytopenic purpura, which is composed of idiopathic thrombocytopenic purpura. So, if we put this idiopathic thrombocytopenic purpura between quotations mark, the website will identify this search term as a single word, and this will help to minimize the search results. Let's try this technique together by putting the search term idiopathic thrombocytopenic purpura between quotations mark and see how the results will be minimized. See how the results are minimized? The search results include 3,550 articles, so it's a working technique to minimize the search results. But in our case, here, the results are still huge number, so we have to use another technique to further minimize the search results. Another technique that can be used to narrow your search results is the use of Boolean operators. What are Boolean operators? They are three words, should be written in capital letters, and, or, not. They are named after a British mathematician called George Boole. They are used to create relationships between search topics or keywords and can be used to narrow or broaden your search. For example, if we write ITB and capital letters IVIG, what do you think? The search results will be minimized or broadened? What do you think? Yes, the search results will be minimized. So, and will narrow the search. Excellent. If we use or capital letters, influenza or flu, what do you think? The search results will be minimized or broadened? Excellent. It will broaden our search results. If we use not, for example, immunosuppressive, not cyclophosphamide, what do you think? The search will be minimized or broadened? Yes, excellent. It will narrow a search results. So we have three words and not, or We can use them to manipulate your search, whether to minimize the search or broaden the search. Here, I use idiopathic thrombocytopenic purpura and capital letters methylprednisolone and click search button, and I got 155 search results, so that the AND or Boolean operator can minimize the search results. If you need to further minimize the search results, we can use another technique, which is the PubMed filters. Let's try the PubMed filter. Once you get your search results, you will see on the left side of the screen the PubMed filters, which can be used to minimize or narrow your search results. For example, you can choose the clinical trials from the article types if your question is therapeutic question. You can use the recent publications by clicking on the 5 years. You can specify humans. You can select the age group between birth to 18 years, the pediatric age group. By clicking on what you want on this PubMed filter, you can narrow your search to the nearest article you need to review. See how the search results are minimized, and now we got only 16 articles. One of them is typically related to our scenario, which is number 4, a randomized and comparative study of intravenous immunoglobulin and megadose methylprednisolone treatment in children with acute idiopathic thrombocytopenic purpura, which is typical of our case. So we need to open this article just by clicking on the title to see the abstract. Also, you will see a link that can be used to get the full text of this article. So you can click on this link to get the full text if it is available for free on the PubMed. Yes, it's available and you can read the whole article on the PubMed. Now we have finished the first technique, which is the keyword technique. And we have learned how to manipulate our search by using other techniques to narrow or broaden the search. For example, we use quotations mark to narrow the search, Boolean operators and or not to narrow or widen the search, and the PubMed filters to narrow the search. Now we are moving to a second technique, but before leaving the first technique or the first search results, I want to save some of the search results on the PubMed clipboard. What is PubMed clipboard? These are temporary folders. You can keep the preferred articles in it until you finish your all search techniques and then go to the clipboard to pick up your articles. For example, I want to keep the first 4 articles in that clipboard before moving to the second searching technique. So I will tick the first 4 articles. Then I will go to the word send to and tick on the clipboard. Okay, so they will be added to the clipboard. Now the icon clipboard is apparent on the web page and it contains 4 items that I have sent to it. The second technique is the using of related citation methods. And by the way, this method will solve the problem of synonyms that we have mentioned at the start of the PubMed search. Let's go back to the search results of the first technique, the keyword technique. We have found that this article, which is typical of our scenario, and we have opened this article and see the results. Okay, now we want to see other articles dealing with the same subject. You have to click on this related citation. Once you have clicked on the related citations, it will direct you to the articles that are dealing with the same subject. See, all these articles are dealing with the use of intravenous immunoglobulin or methylprednisolone in treatment of children with acute thrombocytopenic purpura, and this will solve the problem of synonyms that we have mentioned before. Just by ticking on the articles I need and then send them to the clipboard to be added to the clipboard. Another search technique on the PubMed is the searching using the search builder, and its main function is limiting the search by many ways, including author name, title, word in abstract, publication dates, and so on. You can get into the search builder by clicking on the advanced search on the PubMed page. Now we are in the page of the PubMed Advanced Search Builder, and as you can see there are two search boxes. Let's see together how can we use this method to limit our search. You want to get all articles about aplastic anemia published by young author. How can we transform this objective into practical steps? Follow us. Remember, we have two search terms. We will write these two search terms separately, one in each search box. Let's write in the first search box Young, which is the author name, and from the drop-down list beside the first search box we will select the word author. Then, in the second search box we will write the second search term, which is aplastic anemia. And from the drop-down list beside the second search box we will choose the word type. Now we have two search terms present in two separate search boxes. Now you will click the word search and you got your search results. Another search technique, which is very easy technique used by the very busy clinician, is the clinical queries. You can get into the page of the clinical queries from the home page of the PubMed just by clicking the word clinical queries. Now we are in the page of the PubMed clinical queries, and on the left side of the page you can see two boxes. The first box, you can select from it the type of your PICO question, whether it is therapeutic or diagnostic or prognostic question. And from the second box, you can select your search results. Do you need your search results broad or narrow? Okay, we have typed in the main search box the word aplastic anemia, and then we select therapy from the category and narrow from the scope and click search. In this page, we can notice the search results are presented in three columns. The first column represents the clinical study category, the second one represents the systematic review, and the third one represents articles from medical genetics. Now we have finished our search techniques and we are going to the clipboard to pick up our articles we have saved in it. You can get into your clipboard by clicking on the word clipboard on the right side of the screen. All articles you have saved in the clipboard are arranged sequentially, but in the form of title and the publication information. If you want to open the summary or the abstract of these articles, you can just click on the display setting. By clicking on the display setting, you can select how can you display these articles. Now we want the abstract. Just click on it and click apply. Now all articles you have saved will appear in this form: title, publication information, and Abstract. Congratulations, we did it. We finished our search in the PubMed. These are the items we have reviewed together. Formulate your search key concept. Start your search in the PubMed. Do search by keywords. Use Boolean operator. Use PubMed filter. Use PubMed search builder and use the clinical queries. Thank you